Examination of the hand and wrist. The aim of this video is to introduce students to the examination of the hand and wrist. The objectives are: demonstrate the ability to examine the normal hand and wrist, perform tests of muscle power and range of motion for each joint, demonstrate assessment of hand function, describe the physical signs of arthritis in the hands, and demonstrate assessment for carpal tunnel syndrome. Begin by introducing yourself to the patient and explain the reason for examination. Inspection. Expose both upper limbs up to the shoulders. Place both hands on a pillow, palm side up. Note the finger cascade. This is where the fingertips point towards the distal pole of the scaphoid or thenar eminence. You will also notice that the flexion of the digits increases from index to little finger. Inspect for any swellings, color changes of the palm, and for the presence of any deformities. Inspect for any muscle wasting, especially over the thenar and hypothenar eminences of the hand. Note any muscle wasting of the forearm muscles too. The flexors of the wrist and fingers are at the anterior aspect of the forearm. Ask the patient to turn over their hands so you can inspect the dorsal surface of the hand and forearm. Check the forearm for extensor muscle wasting. Inspect the dorsum of the hand for any intrinsic muscle wasting, also known as guttering. Observe for presence of any swelling over the joints as well as skin and nail changes. Palpation. Using the dorsum of your hand, feel for temperature over the joints. Using both hands, proceed to palpate the wrist joint. You may start from the ulnar side to radial side or vice versa. Palpate the wrist with both thumbs on the dorsal surface, with the wrists supported underneath with the index fingers. Proceed to palpate the metacarpophalangeal and interphalangeal joints. When palpating, you are attempting to elicit any sign of tenderness. You are also trying to identify any swelling. Boggy swellings signify synovitis. Also palpate the carpal bones, metacarpals, and phalanges. Movement. Assessment of movement should include both active and passive activities. Firstly, ask the patient to actively make and unclench their fists. If there is any abnormality, proceed to passively assess the affected joint and its movement. For active extension range of motion of the wrist, ask the patient to keep the forearm horizontal while opposing the palmar surfaces together. To assess active flexion range of motion, the patient should keep the forearm horizontal while opposing the dorsal surfaces together. Next, ask the patient to keep both elbows flexed to 90 degrees and kept close to their body. With the palmar surface up, the patient should attempt to ulnar and radially deviate their wrists. Assessment of hand function. Assessment of hand function includes key grip, pinch or pincer grip, power grip, finger opposition, using buttons, opening a screw top jar, and writing. Complete your examination by examining for carpal tunnel syndrome. Signs of carpal tunnel syndrome are wasting of thenar eminence and numbness of the radial 3.5 fingers. In the presence of these signs, you should proceed to perform the Tinel sign by tapping over the distal crease of the wrist, proximal to the flexor retinaculum, just before the median nerve enters the carpal tunnel. A positive sign is elicited when the patient complains of shooting pain in the distribution of the median nerve. End your examination by thanking the patient.